So, as a junior doctor, as a junior psychiatric doctor, I never questioned the medical model. I just thought that's the that's how it is. So we would do if someone comes to see us in outpatient clinic or they're admitted to hospital, we'd be looking at the history, the what their original diagnosis is, or what diagnosis they already have, or we will say, okay, we are going to assess for diagnosis, and we are going to look at possibly what's caused it, or like when we say what caused it, like what's the biological cause, what's the psychological cause, what's the social cause. So we call it a biopsychosocial model, and then we look at like what can help. So I found it quite limiting, and I didn't ask any questions to my seniors, and I don't think they had any answers themselves, because we were trained in such a way. We're trained that this is how we treat mental illness. You first of all take a history, you come to a diagnosis, a differential diagnosis, and then we can look at what the causes could be, and then we treat them. And the treatment would be medication, a combination of medication and CBT or talking therapy, and looking at some kind of social aspect of the person, which is like the housing situation or family dynamics, that kind of thing. And I started to feel dissatisfied, because people were coming into hospital, and it seemed like they got better, but that's from the inpatient, working in the inpatient wards. You seem like, okay, after they are acutely unwell, they seem to get better, but that becoming better does not seem to be sustained in the community. The longer someone has a diagnosis of a mental health condition, and the longer they are open to services, chances are they end up with more and more medications, something we call polypharmacy. And because I work both as an inpatient consultant in the past in NHS, and that was like for a rehab. I was a rehab psychiatrist. So you can imagine, I have not only worked with people who have stress and anxiety, or bereavement issues, or acute stress reaction, or acute psychosis. I've also worked with people on what we call the severe end of the spectrum, schizophrenia and bipolar, just to name a couple. There's something about like I've seen that by the time they end up in a rehab ward, they have been on they have been having a label of a mental illness for a long time, and they have been on several different medications, and everything has been tried. So then that made me ask, like, what does medications do? I've realized one of the insight is that medications are not a cure. They can help people, especially in the acute when they are having an acute crisis. It can help people, but in the long run, I have seen medications do more harm than good, especially because we get side effects, and the side effects you're adding under the medication. Then someone ends up with type 2 diabetes because they are on high dose antipsychotics. Also, they are that no one has been looking at the diet, and the diet consists of lots of processed food and so on. So then you also end up with lots of physical health medications, not just for type 2 diabetes, but also for cardiac issues. So those are something I've seen, and something we need to question, like, what are we doing to help people when we say we are helping with evidence-based medicine, we're practicing evidence-based medicine. Are there shortcomings of evidence medicine? And I would say, hands on heart, I do think there's a shortcoming. If we just focus on take your medications, take this pill, take this for the rest of your life, or do some CBTs, and or just work on your family dynamics. That's very important, mind you, but we are not talking about beyond that. We are not talking about what needs to happen for a shift to happen, for a transformation to happen in people's lives. Because of frustration on my part. For a long time, I was sitting on the fence and complaining about mainstream. I said, oh, we are so, used to diagnosing people. We are so used to giving medication, and we have all the side effects, and we are not seeing any transformation. There's something missing in mainstream. And I was in the complaining mode. I was being a victim myself to the system, saying like, oh, no one can do anything. And then it occurred to me like, hang on a minute, I'm a psychiatrist, I'm a coach. I see something very, very powerful about, what's missing in mental health. And so why am I not taking a stand? Why am I not taking a stand for sharing and understanding that I know really can make a difference, and I know has made a difference to a lot of my patients, but also like worldwide, because what I share is something called the three principles understanding. Also what I say, I have coined as mental wealth. And before I proceed to the Beyond Diagnosis program, I want to make a distinction between what is mental health and what is mental wealth according to how I see it. When we use the term mental health, actually we are talking about mental illness, all this whole spectrum of mental illness. We also throw in well-being stuff. So we might say that, oh, we need to do this for our mental health. So, but everything is clumped in the same container, so to speak. So it's all about illness, and oh, you do your best, but you have got an illness, you have got a label. This is it. You can cope with your mental illness by doing all this well-being stuff, but that is it. You need to live with this for the rest of your life. So that's quite a gloomy picture in my view. We are not empowering people, because also people think there are other experts out there. They know about mental illness, and I need to rely on them for my own well-being, for how I need to look after myself. So that can be a very disempowering container or stance for people when we, use the term mental health, mental illness. Coming back to the original question about what's the risk of this term, or what's the downside of the term mental illness. So that's how I see it. I have termed the coin mental wealth because I'm pointing again, like I love by the way, I love this festival you're doing, because you call it Mental Health 360. What I'm pointing to people to is 360. So I think this is where I was approached. I knew that our views, our opinions will resonate with one another. So I see mental wealth as like the paradigm I share with people is not what's wrong with you, because that's a mental health paradigm. My paradigm is what's already within you. And so when I was frustrated with like, oh, but we are not doing much, or we are not seeing transformation, I said, what stops me from creating a program called Beyond Diagnosis? So the essence of Beyond Diagnosis is pointing people to who they truly are. So I would say that we all have access to mental wealth. Whatever we're looking for at a fundamental level, we could be looking for peace of mind. We could be looking for happiness. We could be looking for satisfaction, contentment, and love. All of that at a deeper level is who we truly are. So my program Beyond Diagnosis helps people to look in that direction, also to find out how does the mind work. When I have all these experiences, whether you call it delusion, whether you call it flashbacks, or whether you call it voices, where are these experiences actually coming from? Because if the one thing people learn is not to get scared of the experiences, and this is a quote, by the way, by Sydney Banks, if people learn not to get scared of the experiences, that itself will change the world. And that's the person who discovered the three principles said, and I completely get it. I think where people are struggling is because they're so scared of the experiences, the symptoms they're getting, and all we are doing is we are labeling symptoms, and we are trying to fix the symptoms, really not taking people to like, but what's the, where are your experiences coming from? So that's educational. My program is about educating people about how the mind works, but most importantly, who we truly are. Because when we know that whatever we are looking for is already within, we feel more empowered. What I'm pointing to is psychospiritual. Very quickly, I will say that, okay, the brain is biological. We know that the brain is biological, meaning when I was in medical school, we had this specimen of the brain. We had a specimen of the human body, and we could put the brain in the hands and say, okay, this is the brain, and we are studying the brain. But think about mind. We say in psychiatry, psychiatric conditions are disorders of the mind. So can you put mind in your hand and study it? You can't. It's formless. So there is something to see here, that if we are trying to study the mind and we think the mind is only inside the brain or only inside the body, we are missing a significant clue as to what can really help people transform people's lives. So what I point to, and what my program Beyond Diagnosis is about, is going beyond the label, going beyond our identity as a human being, or who I am is this form, who I am is a person who had all the trauma, to going beyond that to like, what am I? What's my true essence? So that's what I share in the program, and why that inspiration to create something that's not there. So I want to slow down here and say that when someone is acutely distressed, they really are scared. They are really, feeling hopeless, and they want to feel better. So the most important help, the most important support at the moment is someone who can like not judge you, someone who can be there for you and hold the space, because in that moment you're lost. I also share with my patients and my clients that you may be lost, but you are not broken. Because when people are acutely distressed or they are going through a very, very challenging time, they think they are broken. They think there's something seriously wrong with them and they want to be fixed. And there's a lot of, in the media, there is this thing about when you are feeling, when you are mentally suffering, need to go and speak to someone. That's important. I think you need to be able to have support for sure. So depends on what support means to you. But I think the main foundation is to have a place where you are not judged, where you are given that support you really need. And sometimes that support might look like, because if someone is really unwell and they are having thoughts of harming themselves, or they are having thoughts of hurting someone else, then of course safety is very, very important. That could be like a safety container, ensuring that you are safe. That might be a hospital admission, that might be having close families who are like supporting you 24/7 during the crisis period. And of course there's a role for medication. Now I'm not anti medication, and I think there's a role. And I would have to want to add something here. You need to ask yourself, why do I want a diagnosis? What is it that the diagnosis is going to give me that I otherwise won't have? And I have asked my patients this, why do you want a diagnosis? And the answers I get mostly are like, well, then I'll know what's wrong with me. So already it's a paradigm of like, oh, I want to know what's wrong with me. And then once I know what's wrong with me, I will have a treatment pathway that's going to work for me. And I know that people think that the diagnosis is going to help them immensely. And it does. At least initially, I have seen people get a real sense of relief, like, oh, thank goodness. So, oh, I'm not going mad. So there is a condition called this. So it does seem to help. And then people come up with the same stumbling block, like, okay, I've got a diagnosis. I even got medication. I've got antidepressants. I've got antipsychotic. And my life is still not better. Because there's an assumption that when we get a diagnosis and when we get what we call treatment, our lives will transform. And it's not that. Because there's still, there is a psychological way of being, in a psychological suffering that's still happening. The medications can numb the suffering. But you don't want to go about life feeling numb all the time. You also want to enjoy life. So yes, you can, if that's what you really want to, you can go for medication. But the most important thing I would advise you is something called informed consent. Meaning you get all the information you need before you even start taking medication. And I know there's a problem, and I've heard a lot of stories, especially from people, my family and friends in India, where doctors don't give informed consent, or they don't share information for the patients to give informed consent. So, like, I'll give you an example. Someone I spoke to, their close relative has got, mental health problems. They have got a diagnosis of bipolar. And I said, okay, what medication are they on? Because they said they're quite on different medication. And I said, why are they taking this for? What are they taking this for? They have no clue. They have no clue why the doctor gave them medication, except that the doctor is, someone with authority. They know what they're doing, so we are just going to trust them. I would say, please, please, please don't do that. Even if you have a diagnosis or you're going for a diagnosis and you really feel strongly that you want one, so be it. But like I said, you need to think what the diagnosis is going to do for you and be realistic about what it can do and what it can't do. And also, like, if you're prescribed a medication, before you take it, you need to be informed about the risk and the benefits of taking medication. So please discuss with your doctor. That's what I would say. Informed consent is very, very important. And also, what happens if the medication doesn't work? What happens if you want to stop the medication after using it for 6 months, for example? Most doctors might say, well, you can just stop the medication. That's going to be a disaster. So these are my advice to you. I think I wrote down a list of questions I would ask for informed consent. And I'll see if this is relevant to anyone who wants to see that. But it's all part of education. You might need to educate yourself, and you might also need to educate your doctor. Like, you really need to share information with people. So that would be my tip or my advice. So my takeaway is a quote by a psychiatrist from the US. The quote is, a diagnosis describes where you are, not who you are. Meaning, if you're looking for a diagnosis, or if you have a diagnosis and you feel that, okay, this is, this is who I am, it's definitely not who you are. It's where you are in life. That's where you are with whatever is going on in your life and the suffering you're experiencing. But if you realize that that's not who you are, the diagnosis is not a description of who you are. It begs the question, like, who am I then? Who am I truly? So for you, my takeaway message for you is to really look at life like not something to, like, oh, it's just a mundane, I just wake up in the morning and I go about life, I go for work, I do my studies, and then I hang out with my friends, and I go back to bed, and I sleep, and the next day I start this whole thing again. There's something about finding meaning and purpose in life. There's something about when we ask, like, what's my role? Like, what's a deeper meaning of my life? And how can I live life fully? When you ask yourself those questions, you'll find that you are not so satisfied with just, for example, having a diagnosis or limiting yourself because of a diagnosis. Because what I see is that people find diagnosis liberating to start off with, and at some point it also becomes very limiting. And please know that you are much more than that. And so one last thing, if you were to ask me, and this is from my mentor, Dr. Bill Pettit, as well, the root cause of all mental health problems, all mental illness, is chronic mental stress and suffering. No matter what the DSM-5 diagnosis is, no matter what the ICD-11 diagnosis is, no matter what you think you have got, if you think you have got an illness, or if if someone else thinks they have got an illness or disease, is basically is at some level is chronic mental stress and suffering. So what's the ultimate solution for mental illness or disease or disorder of the mind? Is peace of mind. It's really for you to explore how can I have more peace of mind? And the answer always is to go within. So that's my takeaway for you. Thank you so much.